Hello, my name is Dominic Guarino. I'm a Senior Technical Advisor at KCAS Bioanalytical and Biomarker Services. Today I'm talking to you about our large molecule bioanalytical capabilities. Basically, we have three types of large molecule services. That is custom validation. Now, custom validation, there is no testing previously performed by the client. What a custom validation entails is feasibility, development, optimization, and subsequent validation of the method. We have the capability of procuring reagents for clients. This is a full de novo assay and can take anywhere from 4 to 8 months. The next service we offer is the partial validation or transfer of a method. This is where clients have done some previous work in a laboratory, either their own or another CRO. And those groups will have either a partially developed method where they transfer the method to us, and we subsequently can either develop the method further or optimize the method further and then perform a validation. And this is the majority of the type of work that we do here at KCAS. And the final service is a fully validated or transfer of a method. And that is when a client has an actual validation report, a standard operating procedure, or some sort of test procedure they can provide, and then we can transfer the method and validate the method. The partial validation transfer takes approximately anywhere from, again, the 4 to 8 month range, and the fully validated transfer can take as quick as 4 weeks or 6 weeks. So on average, KCS performs about 25 to 30 validations or qualifications in our large molecule services. The breakdown is on our ECL platform or our mesoscale discovery. We do about 10 to 12 of those annually. And some of the pros of the ECL method: it has a large dynamic range. It's cost effective for multi-analyte analysis or biomarker analysis. And there's minimum sample volume needed relative to an ELISA. The cons is frequently it's a custom plex, having to bridge more reagents when it's a custom like that, or plates specifically. You do need a specific piece of equipment. And lastly, there is a slight upcharge if there's just a single analyte relative to the ELISA platform. The second platform we utilize is the ELISA. And again, we do about 10 to 12 of those annually. It's standard technology. It's been around for at least since the 50s or 60s. There's no special equipment, meaning a spectrometer reader is universal. Doesn't matter which instrument you have. And it's most cost-effective in terms of single analyte. It is cheaper reagent-wise than the mesoscale discovery system, for instance. Some of the cons, the dynamic range is somewhat limited. The dynamic range for an ELISA can be narrower than the MSD platform. There is just single analyte analysis. No one's developed a way to do 2 analytes in an ELISA, well, at least to the best of my knowledge. And it can consume a lot of volume of sample, almost 4 times the amount relative to the mesoscale discovery system. We also perform flow cytometry. That's a technology that measures the properties of a single cell. This is done by fluorescence, light scatter, and other properties of cell and particle counting. And it can provide correlated data that different population profiles. And what that means is you can stratify data based off of flow cytometric phenotyping. It also is frequently used in the oncology space for efficacy of biologics for cancer therapeutics, where you take a baseline measurement on the flow cytometer and you can subsequently see augmentation of patient T cells against the vaccine in subsequent analysis. Lastly, in terms of our services, it's the soluble molecule detection, or the Simao by Quanterix. It's the ability to measure within the femtomole measurements. It allows for a digital readout of each individual enzymatic reaction to determine if a target is bound to its analyte. It's approximately 100 to 1,000 times more sensitive than the conventional ELISA, as well as the mesoscale, 1,000-fold more sensitive than mesoscale. And it does have multiplexing capabilities.